Hi, my name is Roman Ashmyan. I'm an orthopedic surgeon. I specialize in shoulder and elbow surgery. I currently practice at Southern Ocean Medical Center as well as JFK University Medical Center. So I try to treat all my patients like I would my own family. I always attempt to go with conservative measures or measures that don't involve any surgery first, offering things like therapy, injections, maybe some type of medications. If we decide to proceed with surgery, I will counsel them and have various conversations about the risks involved, what does the surgery entail, what is the post-operative course going to be, and then after that, my patients know that I continue to be there for them and am available for any questions or concerns they might have. If I'm seeing a patient and they decide that they want to proceed with a shoulder replacement, what I'll do is I'll get a CT scan of their shoulder. And what I'm able to do is I actually do the surgery on the computer before I ever do it on them. After that, I order a guide and I'm able to use that guide during surgery to position the implants just like I did on the computer. For someone who comes in and they haven't had much use of their shoulder, maybe, for months or maybe sometimes for years, and then a couple of weeks after surgery, they're relatively pain-free, able to elevate their arm. That's something that's very rewarding for me.